Hey, it's Dr. Troy here, the Vancouver chiropractor. You know, a lot of patients ask me, Dr. Troy, what's the difference between surgery and chiropractic? Should I do surgery? What do you think? And so, you know, a lot of patients will present with whether it is neck pain or back pain. Those are the two most common surgeries you see, maybe a fusion or a laminectomy. And I always ask, you know, I had a recent patient that they recommended she have surgery because she was having pain in her arm. And I asked her, I said, have you had any trauma? Have you had anything like a car accident or a fall or a hit to the head or a blow to the head? And the answer was no. And so in my mind, I think of neck pain, back pain, spinal pain as biomechanical alterations. And many of the medical professionals overlook that. I can't tell you how many times I have people who get in car accidents, go to the hospital, they never got touched. They just were screened to make sure they weren't going to die. Thank God for that. But they left with pain medications and muscle relaxers and said, hey, you'll be fine. Maybe follow up if it doesn't go away with your primary doctor. And so they'll show up in our office and they'll be having these symptomatologies. And I can't tell you how many times people said the doctor recommended I have surgery. And there's a lot of research. There's a lot of information. You can find it on the web where chiropractic should be applied first. Unless it's a life-threatening, traumatic thing where you break a bone, there's fractions. And my wife even broke her pelvis one time in 7 different places. They were going to recommend surgery. They found out at the time she didn't have insurance, so they said, no, we're not going to do surgery. Let's just see if it'll heal on its own. And it healed perfectly on its own, without the scars, without the pins. So, you know, they found research in the medical war on chiropractic. They found that the more surgeons there are in an area, the more surgeries are performed. So I'm of the mindset of let's try a conservative approach first. Let's try chiropractic. Let's see if we can get you functioning better. And then, you know, if that doesn't work, maybe surgery is needed. But let's try that as a last resort, because once the surgery is done, you can't undo it. And the success rate for spine surgeries is not very high. It's in the low 10%. I've even seen some stats that say 95% of back surgeries are needed to be repeated within 5 years. So that means there's a 5% success rate in 5 years. So if we can go conservative first, I think that's the best approach. Be happy to schedule you a time to come see us, see if chiropractic's right for you. Free consultation, 360-260-6903, to see if we can help you avoid surgery if possible. There's a lot of natural different techniques that we can use to help the body function and feel better naturally and on its own. So Dr. Troy here, the Vancouver chiropractor.